You're listening to Addiction Medicine Beyond the Abstract, the official podcast of the Journal of Addiction Medicine. If this is your first time listening, thanks for coming. Addiction Medicine Beyond the Abstract is produced for your enjoyment and is focused on the latest journal-published research and science in the field of addiction medicine. Remember to add us to your favorites in iTunes, and you can also follow us on Twitter at ASAM.org and Facebook. Now, let's go beyond the abstract. Welcome to another episode of Beyond the Abstract. Today we're talking to Dr. Ryan Alexander about his recent article, Withdrawal Signs and Symptoms Among Patients Positive for Fentanyl with and Without Xylazine. He discusses how identifying the unique effects of xylazine on opioid withdrawal can improve OUD treatment and what kind of future research can help determine the impact of xylazine on withdrawal. Dr. Alexander is an addiction medicine specialist and is currently the medical director for substance use services at McNabb Center in Knoxville, Tennessee, and is an assistant professor at the University of Tennessee Graduate School of Medicine. In addition to treating patients, Dr. Alexander conducts clinical research and has published multiple articles related to addiction medicine, and he also regularly teaches medical students, residents, and other medical professionals about treating substance use disorders, reducing community stigma towards individuals with substance use disorders, and expanding access to medication treatments. Now let's get into today's talk with Dr. Ryan Alexander. Dr. Alexander, let's start our conversation today. Let me start by asking you, why addiction medicine? Of all things, what was it that got you interested in this specific field? And I'm curious, what have your experiences been like over the course of your career up to this point?
Yeah, so my first experience in addiction medicine was not in training, not in medical school. I think like many people, they didn't have that part sort of built into our curriculum. So it wasn't until I was doing some moonlighting in residency that I came across addiction treatment as a specialty at all. And I loved it because it integrates the social determinants of health, and you get to experience raw humanity. You know, these people are sort of at the rock bottom of their lives, and you sort of experience their lives through their stories and the uniqueness of each story, but the similarities, the threads that go throughout, all sort of highlight how someone's life can be dramatically impacted by addiction, and it's really driven by the social determinants in many cases, and seeing that firsthand and consistently among groups highlighted how important it is, the systems in place, and healthcare aside from just providing medical treatment. And so that's what sort of got me into it. I ended up going and getting a master's of public health, and that sort of put it all together, and it works out beautifully. That's
amazing. So I want to ask you a little bit about your study now. And, you know, we're going to get into some of the different aspects of it, but I want to start with, tell me a little bit about how identifying the unique effects of xylazine on opioid withdrawal can improve OUD treatment outcomes.
I think that it's important to identify any concurrent withdrawal symptoms because, you know, it's sort of like if you're treating opioid use disorder in someone who's also drinking alcohol heavily and you don't address their concurrent alcohol withdrawal, you know, there could be negative consequences to only treating opioid use disorder in that situation. And it's potentially true in this situation where we know people are being exposed to other non-opioid substances, but we're only addressing their opioid use disorder because we're not really testing for xylazine or asking about it. And so if there is a withdrawal syndrome associated with xylazine, then we're just not identifying it and not treating it, which could reduce the effectiveness of treatment and lead to worse outcomes.
So now your study also found that patients who were co-positive for xylazine and fentanyl had higher systolic blood pressure at the time of admission, and they were more likely to have a self-directed discharge. How can your findings clinically inform this OUD treatment, specifically, you know, withdrawal management? And how do you think that clinicians should consider xylazine when they're treating opioid withdrawal in these inpatient settings?
Yeah, so some of the findings we found in this study were pretty nonspecific. We were using measures that we already collect as part of the standard treatment protocol. And we looked at things like vitals that may be altered in the case of chronic exposure to xylazine because of its mechanism of action as an alpha-2 adrenergic agonist, and it potentially reducing blood pressure over time, removal of that exposure could result in opposite effects. So the fact that we saw elevated blood pressure and other sort of non-statistically significant findings that correlated in that realm just indicate it's worth looking into further. And the self-directed discharge, that being elevated in the xylazine positive group is concerning, because that could indicate that people who are exposed to xylazine are not responding to treatment as well, and maybe not being able to complete treatment as frequently.
What then, tell me about, what are some of the limitations of using like the COWS tool to evaluate withdrawal syndrome when you're trying to identify a unique xylazine withdrawal syndrome from an opioid withdrawal syndrome in patients? Then to follow up with that, I'd ask, what other factors and symptoms of withdrawal could be tracked to kind of identify and isolate xylazine withdrawal syndrome from opioid withdrawal?
Yeah, so COWS is a measure designed for use in opioid withdrawal. And in our study, we used a composite score. So COWS is 11 different measures. And when, compiled into a single score, you're not getting a specific sort of indication of whether their COWS was elevated due to their heart rate or due to their tremors or some other maybe less specific or more subjective measures. And so because this was a retrospective study and we're using the composite score, we don't have that sort of detail. So if, future studies could monitor the withdrawal symptoms among these two groups, but use the individual COWS scores to more get a more granular representation of their withdrawal symptoms and be able to compare, maybe their heart rate is significantly elevated, and that could be a better indicator of where to follow up for future studies. So since xylazine is not approved in human use, it's going to be very difficult, if not impossible, to do studies in humans. So, these any additional studies will have to be observational in people who are using these illicit substances. Or another approach could be sort of evaluating substances with analogous mechanisms of action. So a similar substance or medication that is approved for use in humans is Presidex, which is commonly used in the ICU. And, they have similar mechanisms of action. And that's some questions we've been asking ourselves is, are there any situations where people are exposed to Presidex long term, and do they have any withdrawal type symptoms after removal of that exposure? So that could be a more of a proxy measure, but something worth considering studying.
I know you've touched on a few of these, but tell me about some of the future research questions that kind of emerged from this study, and what kinds of research studies do you think would actually be able to address those questions and find some answers?
So the big question we were trying to ask, obviously, is there a withdrawal syndrome related to chronic exposure of xylazine? And it's a big question. It's a big ball of wax because, if you look at just the mechanism or just, analogous human medicines, it's hard to answer, just like it's hard to answer, before the fentanyl wave, it would have been hard to answer, is there a long-term withdrawal from fentanyl, because its mechanism of action, indicates it's only, a very short-acting opioid, and it would be, there was never any studies of long-term exposure to fentanyl, so it wasn't really answerable until people started misusing it and we started observing it and monitoring. And so the same thing, I think, is true for xylazine. It wasn't studied. It's never been studied in humans, and it's It's not a question people have been asking for Precedex, because that's not a medicine people are exposed to long term. And so it's something we have to just track and do more observational studies with maybe more granular measures like individual COWS scores, but also and doing more observational studies with larger sample sizes. Those two things would help significantly. But also there's additional questions of, does the amount of xylazine you're exposed to affect the response or the withdrawal syndrome that may or may not be present? And so being able to test for xylazine more frequently, but also quantify xylazine levels that people are being exposed to, would be really important to sort of standardize exposure levels.
So as we come to the close of our episode here, I got to ask you, we're going to shift gears just a little bit. I want to ask you to share just a little bit of knowledge with our listeners. So I'm really curious about what advice would you give to maybe not only your younger self, maybe early in your addiction medicine career, but also advice that you would give to and impart on this, the new up and coming generation or young generation of addiction medicine professionals.
I love addiction medicine, and I think it's a growing field with growing application in all aspects, but I love the diversity. I can work in the hospital and clinics. I love that people get better, and they get better quickly. You really affect people's lives in a positive way by just providing, evidence-based care. And, advice that I wish I could have given myself earlier is, understanding those social determinants earlier on and recognizing addiction as a disease, and that the downstream effects of addiction are so significant, since addiction is, drug overdose deaths are the leading cause of death of young people in this country. It's the leading cause of foster care placement, the leading cause of incarceration, and so on and so forth. Treating addiction upstream, it's not just helping the individual with their substance use disorder and restoring their lives, but helping their families and their communities really flourish and improve.
Dr. Alexander, thank you so much for taking the time to sit down and talk with me today. It was great speaking with you.
Thank you so much. I had a great time.
This ends today's podcast. Thank you for listening to Addiction Medicine Beyond the Abstract. All of today's show links can be found in the show notes. Remember, you can preview additional abstracts at journalofaddictionmedicine.com. This program was produced by the American Society of Addiction Medicine.